Dear colleagues, thank you very much indeed for the organizers for inviting me to this important event, this very important day. I'll speak about ensuring Europe's beating cancer plan and discussing with you how it may address cancer pain, quality of life, survivorship, and palliative care. My name is Patrice Forget. I'm working in the United Kingdom. I'm professor of medicine and pain medicine and anesthesia. And I'm the chair of the SIP platform, SIP initiative, which is the social impact of pain. And I'm board member of the European Pain Federation, EFIC. SIP is much more than the European Pain Federation. It's a partnership between the EFIC and Pain Alliance Europe, which is, as you know, this umbrella organization representing more than 400,000 people living with chronic pain. And this forum, SIP, this forum is a very important opportunity to discuss how pain awareness is good enough or should be promoted or among the different stakeholders to be sure that that everything is done to facilitate life of people living with pain, and also to act at a system level and at the political level, at the national level can be important for SIP Portugal, of course, and sharing best practices among different countries, and then to act at the European level also, and that's particularly important, for instance, regarding the work we're doing with members of the European Parliament. So the objectives are raise awareness of the relevance of the impact that pain has on society, the health and the systems, exchange information, share best practices, and develop a European-wide policy strategy to improve pain care. I'm co-chairing SIP with Deidre Ryan, which is the president of the Pain Alliance Europe. That's absolutely essential to have this kind of partnership shared between professionals, healthcare professionals, and patient representative. And SIP would be nothing without this great team with Jamie Wilkinson, which is SIP project manager, Angela Cano Palomares, who's advocacy project assistant, now officer, and Laura Thyssen and Emilia Kozinska, which are very important person as well. And SIP would be nothing with the national platforms, obviously, including SIP Portugal. And all these different platforms have different perspectives and different activities, and then can share different ideas and a project. Just to present briefly SIP history, actions, and what we have done till now. In 2009, creation of SIP made it possible to start with different activities, and not only on cancer pain, but as you can see, last few years, especially in 2021, the cancer pain policy recommendations were the results and final outcome on the discussion of the different activities that we had before, and that we formalized in a cancer pain position paper, and we still continue to work on that. And the long-term priorities as at different levels, and obviously there is kind of cross-fertilization between these different these different priorities, pain should be considered as an indicator. So the existence of pain assessment in any kind of project, not necessarily centered on pain, but for instance, centered on cancer treatment, and life of people living with a cancer or after cancer treatment. The existence of pain assessment and integration of that is absolutely essential, and not only pain intensity, but also on a biopsychosocial perspective, also the emotional aspects and the social aspects of pain. Pain education is absolutely essential, not only for people living with pain, not only for patients, but also for their families and obviously for professionals. It's not acceptable today that not all medical and healthcare professions and disciplines are not including an obligatory module on pain and different aspects of pain. Pain in employment, that's particularly important, not only for people living with a cancer, but also on a long-term perspective for the survivor. And pain research, we need much research. We need better data. We need to understand better what happens. We need to develop better strategies and more effective treatment. So what we've done, especially in 2020 and 2021, is working specifically on the Europe's Beating Cancer Plan. That was a priority among other, because other priorities may also help anyway to pave the way for a better and more comprehensive approach regarding pain in general and cancer pain specifically. So I will speak a bit on also pain in employment and digital health. The facts are that that's extremely important. Pain is most common symptom of cancer at diagnosis. So we can't consider cancer without considering pain. Between 33 and 40% of cancer survivors suffer from chronic pain. So that's not only something about people suffering from the disease, but also after the treatment. That's very important. Anyway, people living with cancer and unfortunately becoming terminally ill experience very, very frequently pain and moderate to severe pain. So we need to have more effective treatment as well. That means that pain treatment is often suboptimal, and that's not just about medication, that's also in terms of psychological aspects. Multi-professional approach is absolutely essential because situation and conditions met by people living with pain and cancer pain especially is very complex. And Europe is very rich because there are different perspectives, different approaches, and different realities, but the variability is unfortunately very uncomfortable and basically unacceptable. We need to have a better homogeneity. And one example of this homogeneity is the existence of quality indicators, how pain is assessed, how pain is considered in the healthcare system, how pain is integrated in the comprehensive management. And we need standards for that, and we need standards for the evaluation, we need standards for the design, and we need standards for the management. For that, we need resources for cancer care services and treatments. We need more resources, and especially for the education, for the training, because we have some good tools for assessing pain and for treating pain and for developing palliative care and for promoting return to work for people after cancer treatment, but we need resources for that. So what SIP does is promoting the allocation of adequate resources for, and especially because there is a problem with cancer and the disease and the terminally ill and the development of palliative care, but also the increased prevalence. The survival has massively improved in cancer and in cancer treatment, which is great. Unfortunately, not for all cancer. And you see that lung and pancreas cancer still continue to have a very poor survival, but there are many cancers where the vast majority of people have a very long survival, much more than 5 years. And this improvement in the survival of cancer people has massively increased during the last decades, which is great, but that means that we need to consider that there is often a life before cancer and a life after cancer treatment. And during the early month or the first year, up to 40% of people have pain following treatment because of the chemotherapy, the surgery, the radiotherapy. After that, fortunately, for people having a good trajectory and a good trajectory, not only for pain, but also for the rehabilitation in general, pain tends to decrease, but not for all people. There is a wide variability, and we need to understand better this kind of variability and to understand better how to rapidly treat and help people manage better the pain they may have after cancer treatment. One of these is, for instance, the polyneuropathy after the chemotherapy, very frequent after chemotherapy. Unfortunately, that tends to decrease, but that continues to be important and significant for a proportion of people. And if sometimes it's severe, if sometimes it's still a significant problem, unfortunately, pain is often undertreated. These numbers, this enormous number of 31% is for pain linked to advanced cancer. 31% of people living with moderate to severe pain have an undertreated pain problematic, according to Greco and Van den Buyken. And these numbers are 5 to 10 years old, but unfortunately that continues to be more or less the same. So we need to understand better why pain is often undertreated and to improve that. Obviously, that's complex. And on a medical perspective, on a biological perspective, that's complex. Cancer is a complex disease, but also the patient experience is complex, and everybody is different. Obviously, there is a tissue damage, there is a tumor, but the goals of each patient might be different. Knowledge, understanding can be different. Coping skills are different, and expectations are different. And then the system, the healthcare system, response should be different according to these different points. And that may change for one person living with pain and during the cancer treatment. The expectation may change over time. At some time, it may be more function-oriented, going back to work, having a better quality of life because more activities. And at another time, that may be more linked to symptom control, pain control, a more palliative approach. And that's important to develop strategies to be responsive and to open and ready to identify clearly what is important for the people living with pain, and especially pain in cancer. So these different aspects, functional aspects, and also the side effects of the medications should be carefully balanced, because all these aspects interfere with each other. So that's important to correct or to adjust the strategies depending on that. These three examples are a bit extreme, but that's right. That's some patients. On the left side are more considering that life expectancy is not that long. It's more about end-of-life care, and then clinician approach can be more important, can be more aggressive regarding pain management, and especially with medications. People may accept more side effects in order to have pain relief, even if sometimes side effects like drowsiness is not necessarily something that people would like to have, because people would like to have capacity to interact much with their family. The image in the middle is more about living with a cancer, and sometimes cancer can be very, very, very slow disease, even considered by some like a chronic disease, chronic tumor persistence, but sometimes can be associated with pain. Typically, self-management is something that can work very well, but people wants to work or wants to have a rich life, good quality of life, and then medications are not always the best option to control optimally the consequences of pain. And that's even more true, for instance, for the young person living after, for instance, treatment for prostate cancer. People would like to have a new life, maybe not necessarily exactly the same life than before the cancer, but would like to have a new life and to build something medication free, not thinking too much about the cancer, and trying to rebuild something self-managed, and then trying not to be not to suffer from too many interferences with healthcare professionals. So these different perspectives are very important to recognize. Healthcare professional education is important, because to identify that well, a good classification is definitely helpful. And so the International Association for the Study of Pain has worked with the WHO on the International Classification of Diseases, the 11th version, and there are now good classifiers and good way to identify much better how to distinguish different aspects in pain, and especially in chronic pain. So ICD-11 in implementation, this new classification is absolutely essential, not only in cancer pain, but in pain in general. And that's a good example of a standard, a new standard that we need, and that has been promoted by the European Pain Federation, a new standard to be sure that pain screening, assessment, management, and treatment is optimally offered to patients. And that can go through opioid and non-opioid analgesia, depending on different kind of pain. That's a very simplistic approach regarding pain pain management. And that's important to offer opioids in cancer pain when it can be helpful, even if we know that, for instance, for the cancer survivor, that's usually a different kind of approach, and opiates are not very useful when taken on a long term. Opiates, like medication of the family of the morphine, are useful for days to weeks, and especially in palliative care. But other strategies may be required for other kind of pain. But we have to consider that a good balanced approach is still required. Surprisingly, strong opioids are not as available, accessible as we may hope, especially at the end of life. So there is a strange situation when we know that there is an opioid crisis, an opioid epidemic in chronic pain, and probably an overuse in some part of the continent, or in some patients, especially for chronic pain, opiates are too much used. But for acute and subacute cancer pain, maybe sometimes it's underused. So we need to protect the access to opioids as well. And again, to recognize the individuality of patient needs, and then to have a balanced approach, and to be sure that the right treatment is available at the right time. So on the right side, I told you that chronic pain is optimally not treated with opioids, because opioids typically works for a few weeks or a few months, and after that there is tolerance to opioids, and non-opioids are preferred, or non-pharmacological options. But on the left side, yes, opioids can be very useful in palliative care, can be very useful for people living with advanced cancer. And this balance is not always that simple, because perspective may change over time. But this kind of information, education, and training of professionals and patients is absolutely essential to choose the right treatment at the right time, and to be sure that that patients benefit from the right treatment and are not harmed by unnecessary treatment with opiates when it's not very useful. So there is a wide spectrum of pain. That's very complex. A wide spectrum of perspectives, and a wide spectrum of treatments. And opiates is just one of these. That's a good example to show you that education and screening treatment and adjustment of treatment is absolutely essential, and that there are standards that should be promoted and that could be promoted, but some resources are needed for, and some tools may help may help improve that. What SIP does is, for instance, promoting the ICD-11 classification and the management standards, and that needs to be incorporated in the Europe's Beating Cancer Plan. And when we move to the implementation phase, then that will be important to have to consider that approach must be wide but comprehensive also. So we have key recommendations in the next two slides, and that will be the end of my presentation, and the key home messages. So patients should have access to high quality cancer pain management across Europe. That's very important, and that's important from diagnosis to palliative care and for survivors. Civil society and patient associations should play a central role in the implementation of the Europe's Beating Cancer Plan. That's obvious, but that's not always the case, and that's an important aspect of CIP work, is to strengthen this kind of partnership and important shared perspective, and multi-stakeholder discussions. I've discussed with you very briefly the ICD-11 classification, so the new WHO classification of pain, diseases in general, but pain in particular, and especially chronic pain, and including cancer-related pain. And that may help develop standards and implement standards for the management of cancer-related pain across Europe. That's extremely important. Pain, and in particular in cancer pain, should be added as a quality indicator. And I've mentioned at the beginning and during the presentation, you've understood why it's not only about pain as a number. Obviously, it's more pain as biopsychosocial problem, and these biopsychosocial aspects must be integrated in the education, management, and research also. If we understand better what happens, if we recognize better what happens, we may respond better to these different aspects of pain and offer the right treatment to the right patients. Because pain is frequent, pain is typically cancer-related complication, a very frequent one that can be present in the survivor, but can be also present in people living with advanced cancer. So cancer pain must be considered at all steps of cancer treatment. That needs education and training. And in the immediate future, we need to continue to work on a continued engagement with governments, with national representatives, like with CIP Portugal, and in events like the event of today. Thank you very much indeed. I do hope that it was clear enough, and I wish you a very good day with a fantastic program and very interesting presentation. Thank you very much indeed.